Hi, good evening everyone. Welcome back to another live session. So in today's live session, we are going to look into a very important aspect of OET speaking. And the reason why I picked this particular topic is because no matter how many times students get an idea about this area is a little bit tricky. And the opening statement of a role play is crucial when it comes to presentation because that is when you start off the conversation. And yes, we always want to give a good introduction too because it will boost your own confidence, right? So I have seen many students getting confused and they get really doubtful about what exactly is the correct way to have an opening statement. So I thought, yes, why not we do a live lesson on that. So here I'm going to discuss few introductions like different settings and the common settings. I picked the common settings. I'm not getting into each and every settings that you might get for the exam, but I have generalized the common ones. And I hope while you're discussing or while we're discussing these points, you'll get a general idea about how to handle any sort of scenarios. But before we get into these sessions, the main important thing I have to tell you is that we do not have a script for OET speaking. Okay, nowhere it is mentioned that you have to speak in this particular way or this is the only way you should talk. It's not like that. You need to be making sure that entire conversation is logical. However you open the statement or you move forward with explanations or you build your sentences, it has to be logical. So you need to understand the scenario, the context that you're dealing with, and based on that, you can develop your opening statement, the way you acknowledge, the way you reassure, and things like that. So there is no particular script or there is no no rule like this is the only way you should do it. Okay, so keep that in your mind. And the presentation that I'm going to show you is just one of the ways. I'm not just telling you this is the only way. This is one of the ways, and this can be a little more easier. So for those who find it really difficult to focus on or be more spontaneous when you get scenarios, and if you're feeling like it is little troubling for you to develop your opening statement, then you can try to follow this. Again, I'm telling you, this is not the only way. This is just one of the ways. Okay, so I hope you guys are all doing well. And if you have any questions or queries also, you can please drop in the comment section. I will look at it while we're doing the session, and if at all I miss it, don't worry, later session this will be uploaded on our FB page and YouTube page. I'll go through the messages there, and if you have any doubts on any particular scenarios which is not being discussed in this particular presentation, drop in your queries as a comment. I'll definitely get back to you. Okay, so that is what we are going to discuss today. As you can see, introductions, different scenarios in OET speaking. So before we get into this, let's look into what type of settings you might get. So I know that you might be a fresher, or you might be a repeater, or you might be a person who is going to write the exam but you have a lot of coaching experience. So there might be different types of people who are watching this, but I'm going to start from the basic level. If you already know it, well and good. For those who don't have an idea about it, this is for you. Okay, so the first thing you have to understand is we have multiple scenarios. Okay, there are a lot of scenarios that you can get, and for the easiest way to understand what would be, or the easiest way to club all this will be in two forms, that is under known and unknown. And you can also get a setting where you're talking to the bystander, and that will come under known cases as well as unknown cases. Okay, so to simplify, you can get a known patient or an unknown patient. All right, you can also get a bystander in which the patient might be known. You can also get a bystander in which the patient is unknown. Okay, so we are going to discuss in detail about what are these and how to identify all this, and I will also discuss a common known and unknown settings, and let's see how we can have an opening statement there. So this is just an idea, okay, because we can club this into these two categories. Again, I'm not telling you this is the theoretically approved way of it. No, it is not. It's just for your understanding, okay. It's a general explanation that you can club it into two cases, like known cases and unknown cases, and one exclusion is that we have the bystander cases also, okay. So this will give you an easier idea for you to understand is it is a how to open, like understand whether it is a known case and unknown case, and then depending on that you can develop your opening statement also, okay. So this is what we are going to discuss today. Now let's have a look at known settings. Again, there can be a lot of different known settings that you might come across. I'm not just saying these points which I have listed down here are the only ones, but I have picked the most common ones. Okay, so what is known setting? Known setting is nothing but you might know the patient before. Say for example, the patient has come for a review, or the patient has visited before, or we do have a report of the patient, or we know the history of the patient, or we have examined the patient, which means in short you know the patient. Or it's not like you personally know the patient, okay, but the patient history or the patient's medical history is known to us, okay. That is what is meant by known settings, like we know the patient or we know something related to the patient, okay. So that can be clubbed or that can be categorized under the known settings. Now let's look into the common known settings that you can get. The first one is the very common one, ward. We can also get referrals, test results, home visit, emergency department, and there is an exclusive thing that you have to note here. Emergency department when it comes to examination. If in the cue card it is mentioned that the examination is done, the setting is an emergency department, but while you read the cue card you understand the examination was done, then it comes under the known setting, okay. So these are the common, I'm not telling these are the only, but these are the common known settings that you might come across, alright. Moving on to the next, the unknown settings. Unknown settings are pretty clear for everyone, where we don't know the patient. We are talking to the patient for the first time. There was no previous conversation with this patient, okay. So community health centers, clinics like suburban clinics, mental health clinics, so many clinics, so there's skin clinics, so on so. And we have the emergency department. Here the examination is not done. The patient is visiting the emergency department for the first time. We never had any conversation with this particular patient, so that comes under unknown settings. So these are the points that we are going to discuss today, okay. So let's see how you can identify known and unknown settings. This is also tricky because when I personally take classes, I have come across a lot of situations where students really do not understand the context, and then just they have a wrong start and then they struggle to move on to next tasks and so on. So this is a very easy tip that you can keep in mind to identify the context, identify whether you're dealing with a known or an unknown setting. Okay, so let's see how we are going to explain that. So in order to identify the known and unknown setting, the first thing you have to do is read the followings. The first thing is setting. You have to read the setting which is given on the left top corner. Then you have to read the background information. You might have seen it is written nurse and then a brief explanation about what is being explained or what is being spoken or to whom you are talking, what is the condition of the patient or what is anticipated. All these points are explained in brief there. So that is the background information, and you also has to have a look at the task number 1. So after reading these 3 things, you will get to know whether it is an unknown or a known case. Okay, I always tell all my students and on all my lives or videos that do not jump to a conclusion just by seeing the setting that it is a known case or an unknown case. No. Okay, you have to read through the background information, understand the context very carefully, logically analyze the scenario in your mind, and from that you have to figure out whether it is a known case or an unknown case. Okay, so these 3 things will help you to ease this out. Okay, so that is how you're going to figure it out. Now, we are going to get into the detailed explanations. So I hope it is clear for you guys. If it is, let me know, or if it is not clear also, please do let me know. Okay, so I think you can read it. So we're going to start with noun settings. The first one that we noted was ward. So imagine a ward means a patient is in the ward. As a nurse, you will be physically going there and meeting the patient, right? So have this picture in your mind. Imagine a ward in your mind. And these are the steps that you have to do in order to develop your opening statement. So don't look here. First, we'll go through these points, and then let's see how all these steps can be clubbed into a really good opening statement. So if you identify the setting as a ward, the first thing you have to do is ask the interlocutor the name of the patient, because it is a noun case. So this is the first step. The second step is you'll greet the patient with name of the patient. Okay, so that's the second step. Third step, you'll say your name and your role, who you are. Again, not if it's the first time. I'll explain that later, okay? Just keep this in mind. And the fourth step is where you state the purpose of visiting the patient. You will explain why you are there. And lastly, you will check how he or she is feeling. So these are the different steps that you have to follow to develop the opening statement if your setting is identified as a word. Okay, this is what you're going to do. Now getting back to your third point. You do not have to introduce your name or your role again and again if you're visiting this patient often. Say for example, it is mentioned that you're there for your regular rounds. That means it is something regular. You're doing it repeatedly, so you do not have to walk in every time and say, hi, good morning, this is me and I'm here to do this. You don't have to repeatedly say that over and over again. If you're visiting the patient for the first time, like the patient is in the ward, the doctor said, and nowhere in the cue card it is mentioned that you're repeatedly visiting the patient or you had come before. Okay, so if it is not mentioned like that, then you do not have to worry about it. If not, you have to state your name and role as well. So these are the 5 steps that you can follow to have an opening statement for a ward scenario. Again, I'm telling you, this is not the only way. This is just one of the ways. Do not get confused like, okay, this is the only way. No, I'm not intending to say that. I'm only coming up, or I'm putting forward a very easy and logical explanation of these scenarios. Okay, there are a number of ways of doing it. This is one of it. All right. So let's see a statement using these explanations. All right. So this is the point. Good morning, Mr. Henry. I'm Miss Caroline, one of the registered nurses on duty. I'm here as advised by the doctor to prepare you for the surgery. How are you feeling now? So this is your opening statement for a word. Now let's have a look at this. Ask the interlocutor the name of the patient. We got it, Mr. Henry. So the next thing we are going to do is greet the patient with name. Good morning, Mr. Henry. Simple as that. Then you are going to say your name and role. I'm Miss Caroline, one of the registered nurses on duty. So your name and your role. Okay. Then we are going to state the purpose of visiting the patient, which is going to be clearly mentioned in your background information. So just have a look at that and go forward. I'm here as advised by the doctor to prepare you for this surgery. And lastly, you will check how he or she is feeling. How are you feeling now? See, it is as simple as that. So remember these steps when it comes to word and the logical flow of conversation as well. Then you got a good opening statement. So this is how you do it. Okay, so I hope the word scenario is clear for you guys. Let's move on to the next one. All right. So the next one we have picked is referral. So you know a referral, right? So the doctor will be referring the patient to you. Sometimes the doctor will advise a nurse also to go and meet the patient as well. Okay, sometimes the patient will be approaching you. Sometimes you will have to approach the patient too. So depending on that switch, you have to flexibly shift the points given here. Okay. Now, if it is a referral, the first thing what we are going to do is we are going to greet the patient. Secondly, you're going to say your name and role. Thirdly, you're going to confirm patient details. And lastly, you're going to confirm the purpose of appointment. Okay. Now getting back to third point. Why do you have to confirm patient details here? Because imagine we have a doctor here and you are the nurse. Okay. The doctor told you a person named sorry, say for example, a person named Alex will be approaching you, you'll have to educate the patient on something, okay? So you know that someone named Alex will be coming to you. So you have to verify that you're talking to Mr. Alex itself. So that's the reason why you're going to confirm the patient details, okay? So this is how you're going to have an opening statement if it is a referral. If you see in the background information it is mentioned like this patient has been referred by the general practitioner to come and talk to you. So if you come across anything like this, then yes, this is good, okay? So I hope you are clear with this, all the points. So let's move on. So this is the explanation for that. Good morning, I'm Miss Caroline, the registered nurse working here. For the verification, can you please help me with your name? So the patient will tell you the name. Mr. Alex, I believe you're here as advised by your doctor to have a discussion about, and whatever is mentioned, you can fill in that. Okay? So we're greeting, good morning, and then you have to say your name and role, you're introducing yourself, and then you're confirming the patient details for verification. Okay? You're asking for the name. And then you're going to explain the purpose of the appointment as well. All right, so this is how you can easily do a referral. Okay, so Divya Juju has asked, while speaking, salutation is mandatory. Okay, so I would say it's a courtesy that you have to follow while you're speaking. So it is always good to do that. If the patient, it is always good to have a good greeting and we salute the patient in a very nice way. So it's always good to do that. Okay, I won't say it's mandatory, but it is a good thing to do. Okay, so this is how a referral can be done. Now let's move on to the next non-case setting, which is test result. So when it comes to test result, you might have seen different types of test result in the background information, okay? So I am discussing two main type of test result. The first one is you're visiting the patient to reveal test result. Imagine the patient is in a ward and you are visiting the patient there and you're going to say, I have your test is back, and you're going to explain the point. That is one way of doing it, or one type of test result. Another type is the patient has come to collect the test result. Okay, imagine today the patient came to the hospital, gave his blood or something for a test. So 2 days later he comes back for his test result. So these are the two types that I have picked here. Okay, so let's see how we can do this. In the first case is where you are going and telling this person, yeah, your test is back or result is back. So let's see how we can do that. So the first thing is you have to ask the interlocutor the name of the patient. So if you're dealing with such a situation, you need to know the name of the patient. So you have to ask the interlocutor during the 3 minutes preparation time, what is the name? Then you have to greet the patient, say your name and role. You have to verify patient details because you're going to give out a result. So you need to make sure that you're giving out the result of the right person. You should not just walk in on Mr. Y and tell all the result of Mr. X to him, right? So you have to make sure that you're talking to the right person. And then you have to explain the purpose of the visit, like, I'm here with your test result and things like that. So these are the steps that you have to follow while you're dealing with a referral in which you are meeting the patient with the test result. Okay, so for example, we have seen many cases where the patient underwent the x-ray and you are revealing that he has a broken hand, something like that. So there are a lot of cases like that. Okay, so you can use this very simple way of introduction when you get such cases. Okay, so let's have a look at an opening statement here. Good morning, I'm Miss Caroline, one of the registered nurses on duty today. Are you Miss Susan? Okay, so Miss Susan is saying yes. So you're saying, well, Miss Susan, your test results are back and I am here to discuss it with you. So this is how you're going to have an opening statement. So the first thing is we ask interlocutor. So before the role play, we know it is Miss Susan. So then we are going to verify later part. So before that, you will introduce your name and you'll say who you are, and then you're going to confirm, are you Miss Susan? Because we have Miss Susan earlier, right? We asked interlocutor during the 3 minutes time and we know it's Miss Susan. So we are confirming, okay, are you Miss Susan? And then you're going to state the purpose of this meeting, and then from there you can take it off. So that is how you can handle this case. Now, if it is a second type, the patient has come to you to collect the result. Okay, you are not visiting the patient approached you. So in that case, what you have to do is, you have to greet the patient first, then say your name and role. You have to verify patient details and offer to help. So these are the 3 steps that you can follow in such cases. Okay, so I'll show you an example. Good morning. I'm Miss Caroline, one of the registered nurses on duty today. How can I help you? So the patient will tell you, I'm here to collect my test result. So you're offering to help. Sure. Can you please help me with your name? Simple as that. Okay. So you're verifying patient details and then you will hand over the test result. And then whatever is the next task which is demanding you to do, then you can do it accordingly. So this is an overview of that. So I hope it is clear for you. Let's move on to the next point, home visit. It is a very important as well as a crucial thing that I really wanted to discuss this, because there are a lot of controversies about it. So home visit, you can expect 2 types of home visit. The first time you're visiting the patient, and a routine visit. Like it is a repeated visit. You might be going and meeting this patient on a regular basis, maybe to administer a medicine or to regularly check his or her progress. So it is a repeated visit. You're not visiting for the first time. First time is, something like I can give, if I give an example, like imagine the patient underwent a procedure or a surgery at your hospital. The patient was under your care for maybe 3 to 4 days and the patient was discharged, and the doctor is letting you know, advising you to go and meet this patient on a regular basis, or meet this patient for the first time to see how the patient is doing after the discharge. So such cases will come at the first time visit. Okay, or you are going there as part of an awareness. Okay, there is an awareness program and you're going to do that. So all these things indicate that you are doing it for the very first time. Okay, so what you have to do is, you have to ask the interlocutor the name of the patient. Okay, because you cannot just barge into a person's house without knowing anything about it. Okay, so even if you're going for an awareness program, you might have a record from the local body, the municipality or something, and they might have given you the details, and you will be walking in and checking, okay, is this person's house? So without all these things, you cannot just barge into a house, at least there. Okay, so let's see how you can have the opening statement for that. So first thing is, you have to ask the interlocutor the name of the patient. Then you can greet the patient with name, say your name and role, state the purpose of your visit. Okay, so there are a lot of other ways to do it as well. Okay, if you want, you can go and ask like, hi, is this Mr. David's house? Are you Mr. David? And then introduce you. Yes, that is also accepted. Okay, it is not wrong. Okay, it depends on each person's creativity in identifying the logical order of the conversation. If you feel like that is a proper order, you're well and good. Nobody's stopping you. Just do it. Or if you want to start in a different way also, that's fine. At the end, it should sound like you are in a person's house, and it should actually cater to the needs of a proper courtesy that you have to show when you're visiting a person's house. So that is the only thing you have to keep in mind. Otherwise, you do not have to worry so much about it. Okay, do not just blindly think like, oh, this is the only way. No, there are a lot of other ways. Just keep in mind that when you listen to this, it has to have a proper order. The logical, the sequential flow has to be appropriate. That's the only thing that you have to keep in mind. Okay, so this is the one which I have picked here. So this is just one of the ways. Okay, again I'm telling you, this is just one of the ways. So let's have a look at it. So I told you, you have to ask interlocutor the name of the patient, then you have to greet the patient with name, and you're going to say your name and role and state the purpose of your visit, why you are there. So let's have an example. Good morning, Miss Elizabeth. My name is Richa. I'm one of the registered nurses from Greenwich Hospital. Again, this is an addition that I did. Okay, if it is mentioned in your cue card, you can do it. If it is not, you can come up with a name, or you can say community health center or the nearby hospital or anything. Okay, play with your creativity there. Just make sure it is not a blunder. Then you can say, I'm here as advised by a doctor to assess your progress post-discharge. Okay, that is the statement, the purpose. Okay, why I am there. So this is how you can do it. This is an example of how you can do this particular type of scenarios, home visit for the first time. So I hope it is clear. Now if we look at repeated visit. It's very simple. There is nothing very complicated there. It's so easy to remember. If it is a repeated visit, again you need the name. So ask your interlocutor for the name, then greet the patient with name and check how the patient is feeling. Simple. Okay. You do not have to go through all the same procedures that we saw in the last part, because the patient will be expecting you. Since it is a repeated thing, the patient will be expecting you there. You do not have to walk into the same house again and again and say, hi, my name is Richa, I'm here for this. The next day also coming and saying your name. No, you don't have to go on a repeated mode there. Instead, you can have a simple way of introduction. If it is mentioned that you're there for your routine visit, you can simply say, good morning, Miss Mindy, how are you feeling today? And if needed, you can explain the purpose also. As you already know, I'm here to administer medicine. So then you can do. Then you can do the next task, whatever is mentioned next, and according to that you can move forward. Okay, so it can be a very simple introduction like this. Okay, so that is how you can do home visit there. So I hope it is clear for you guys. Now let's look at the next one. Emergency department under the non-cases. If it's mentioned that the patient has been examined, okay, remember very carefully, only if it is mentioned you have examined the patient or the patient was examined before, then it is a non-case. If the setting is emergency department, but in the background details it is mentioned the patient has been examined, and if it task number 1 is like confirm the findings or confirm something, that means it is a non-case. You do not have to go and introduce yourself and do things like that. Okay, so what you have to do is, the steps are, ask interlocutor the name of the patient, and then you have to thank the patient for his or her patience. As simple as that. Okay, let's keep it very logical. Imagine there is a patient in front of me. I am the nurse taking care of the patient. The patient came to me and he told me all these things, and I told him, can I examine you? Okay, after doing all those introductory facial conversations, I am asking him, can I examine you? And he said yes. So this conversation is taking place after the examination. You do not have to go before that and start right from the beginning like hi, good morning and all. No. Logical order is examination is done, so you have to start from the findings of the examination. That is how it should go. So you can start something like this. Your cooperation is well appreciated, Miss Yasmin. I have finished examining you. Simple as that. Or you can say, thank you for your cooperation, I have finished examining you, and then you can start by explaining what you found. Depending on your first task, you can do that too. Okay, so that is how you have to deal with emergency department under non-case scenarios. So by that we have discussed the common points that will come under the non-case settings, okay, like the ward, referral, test results, home visits and the emergency department. I'm not just telling you these are the only things, no, I have just picked the main. Okay, there are a lot of other settings too. Okay, I have just generalized it and I have clubbed it in a way that these are the points that will be commonly asked. Now let's move on to the very easy setting, unknown settings. There is no complication. So if you feel like this is the first time you're meeting the patient, this is the simplest way to do that. This is the easiest way to do that. Okay, so what you have to do is, in an unknown setting, greet the patient, say who you are, and then see what the patient needs. After that, you can collect the personal details of the patient. Okay. So let's see how you can start. Good morning. I'm the registered nurse on duty today. Please call me Miss Caroline. How can I help you? Simple. Because we don't know anything about this patient. It's clearly mentioned the patient is coming there for the first time. You're talking to him for the first time. You don't know anything about him or her. So it has to be done in a very simplest way by saying your name, who you are, and you have to check why the patient is there. So once the patient tells you why the patient is there, the next thing is very obvious. You have to offer to help the patient, and then you have to collect the personal details like name, and then move on to task number 1 or task number 2 depending on it. Okay, so that is how you have to deal with unknown settings. And depending on the setting which is given, you can change it. Okay, instead of saying registered nurse on duty today, you can say registered nurse working in this emergency department if needed, yes, or in the clinic, yes, whatever is mentioned in the setting. Again, it's up to you. I'm not stopping you here. Okay, this is not the only way of doing it. I'm telling you this again and again because I don't want anyone to get confused like this is the only way. No, we do not have any script. Okay, so like the way I made this, you can also make it. Okay, it is totally up to your creativity. It's not like, okay, this is the only way of doing it. No, it does not have any script when it comes to OET speaking. It's totally up to your creativity and your logical analysis of it. So just try to follow whatever you feel is right. Okay, so this is just a demo of it. So this is how you can follow to do unknown settings. So I hope known and unknown setting, common, the most popular type of settings are clear for you guys. Okay, just follow the steps. Now let's move on to bystander. Okay, so we get to speak to a lot of bystanders, concerned mother, concerned son. Okay, we get a lot of topics like that, right? So let's see how you have to deal with known cases as well as unknown cases. Now, my next question is, what is this bystander known case and what is this bystander unknown case? So I told you there are known cases and unknown cases, okay, where we know the patient and where we don't know the patient as well. So when it comes to bystander known cases, say for example, you're talking to a patient's bystander, the patient is in the ward, so it is a known case, the patient is known to us, right, but you're talking to the bystander. And if it is unknown case, that means it might be an emergency department or a community health center where they're visiting for the first time, like a mother and a son. Okay, the son fell down somewhere and the mother brought to the hospital to see whether the child has any bruises or any cuts or any fractures like that. So there we don't know the patient. So it is an unknown scenario, but we are talking to the bystander. So that is what we are going to see. So we are going to see how you can separate it, and based on that how you can have your opening statement. So we are going to discuss known case first. So if you're talking to the bystander of a known case, the first thing you have to do is ask the interlocutor the name of the patient. Okay, listen very carefully. It is the patient, not the bystander here. Okay, then you will start with warm greetings, say who you are, you will confirm the relation with the patient, and then you will state the purpose of your visit. Let's read that again. If it is a bystander in a known case, first you will ask the name to the interlocutor, then you will start with warm greetings, say your name and role, then you will confirm the relation between this bystander and the patient, and you will state the purpose of your visit. Let's look at a demo. Good morning, my name is Richa. I'm one of the registered nurses on duty today. Are you David's mother? I'm here as advised by the doctor to prepare him for the scheduled procedure. See, this is how you have to have an opening statement. So then she will say, yeah, okay, so here it is David's mother, right? So she's saying, yeah, I'm David's mother. Then you can just say, this is why I'm here. Okay, so she say, yeah, that's okay. And then next you can ask her name. So what would you prefer to be called, or may I know your name as well? And then you can continue with your conversation. So this is how you can deal with a bystander when it is a non-case scenario. Okay, so I hope it is clear. The first thing you will do is you'll ask the interlocutor the name of the patient, then you'll start with the warm greetings, then you'll say your name and role, you'll confirm the relation with the patient, and then state the purpose of your visit. Okay, so this is how it has to be done. It can be done, all right? I'm not saying it has to be done. It can be done like this way too. So I hope it is clear. Now the last one, bystander, unknown case. We don't know the patient. We have no information about this particular patient, and we don't know what is going wrong with this person too. And we are talking to the bystander. So these are the steps that you have to follow, okay? Start with warm greetings, say your name and role, ask for the reason for visit, offer to help, collect patient details, and ask the bystander, what would you like to be called? Okay, so these are the things that you have to keep in mind if you are dealing with a bystander in an unknown case setting. Okay, so let's have a look at the example. Good morning, my name is Richa. I'm one of the registered nurses working here. May I know the reason for your visit? Please be relaxed. You have reached the right place. For the documentation purpose, can you please tell me your son's name and age? Thank you. Also, what would you like to be called, or what would you prefer to be called? Okay, so let's club this and this together. Start with warm greetings. Good morning. Say your name and age, or say your name and role. My name is Richa. I'm one of the registered nurses working here. Ask for the reason for visit. May I know the reason for your visit? So she will tell you the reason, right? Then you have to offer to help. Please be relaxed, you have reached the right place. Then you have to collect patient details for the documentation purpose. Or you can say, before we proceed further, for the documentation purpose, could you please help me with your son's name and age? So she will tell the son's name and age. And we have to ask the bystander again, thank you. Okay, we can say thank you for that. And then you can say also, what would you prefer to be called? And after getting the name of the bystander, you can directly move on to the next task. Okay, maybe offer an examination or ask for the symptoms, something like that, depending on the cue card. So these are the different ways of doing it too. So by that, we have discussed the commonly asked or the common type of settings that you might see for the examination. So I'm telling you again, these are not just these. There can be more additions to this. More types of context will be there. A lot of other different types of context would be there. But these are just the general idea about the common topics that you can get. Okay, if you feel like there are different topics, okay, which was not included in this particular presentation, feel free to comment. Okay, and let's see if others know how to open this conversation. You can comment below that, or I will personally go through all those comments and see and help you guys how to develop the conversation there. Okay, so this particular live session will be there available as a recorded video on our FB page as well as YouTube page later. So if you haven't watched it, or if you don't feel like you couldn't continue watching it, or you missed it, don't worry, you can watch it later and you can share it to your friends who are also preparing for OET. And if you have any doubts related to any particular setting and how to open it or any scenarios, comment below, as I said. So others who know it will also comment or give an answer for it, and so you can learn from it, or I will personally go through that too. So okay, so I hope it was clear for you guys, and I hope you guys got a clear idea about what are the different types of settings that you can expect and how you can have a good and easy opening statement too. Again, I know that I'm repeating this again and again, but still, please do not get confused like this is the only way. This is not the only way. This is just one of the ways. Okay, but this is going to be a little more easy. Get a clear understanding about the context, what is being discussed, and have a logical way of the opening. Okay, when you read the cue card, picturize it in your mind. Okay, this is what is happening. Okay, the patient is here, I am standing there. So have a picture in your mind. Based on that, try to develop your conversation. So then there will not be any confusions or any clarity problems. It will be a little more easier for you to move forward with it. So I hope this session is going to be helpful for you guys. If yes, let us know. Your feedback is also very helpful for us to understand what type of context that we have to provide for you. Okay, so I'll come back with another live very soon. Until then, take care and happy learning with IILT. Please feel free to raise any of your queries or doubts that you might have. So take care. Good night.